Now, I want to talk about another solution today that is really very promising, which is stem cell therapy. It's shown to really give great promise in treating many different types of conditions, especially in orthopedics. A whole new world of treatment. Wouldn't you say, doctor? It's just fantastic.
I would say right now there's still a lot of hype. We are very, very hopeful because most of the results are good to excellent, and people aren't getting the side effects or adverse reactions like they do from other treatments like the pills or the other shots.
So tell us where the stem cells come from.
So we all have stem cells everywhere in our body. So even in your bloodstream, right? So in this particular picture, you have your red blood cells. This is representing a stem cell. Now, stem cells are kind of, in Spanish they like to call it the mother cell. It's the cell that it can differentiate or change into all the other types of cells. So whether it's bone, or whether it's organ tissue, or whether it's a tendon or ligament or cartilage, this is it. It normally sits more in the bone marrow or in the bone, and then gets released as needed. So in orthopedics, one of the biggest challenges is getting tissues to repair themselves. And certain injuries heal very well, and a lot of times that's because the blood flow to that area is good. And so all of these repair cells, whether it's the platelets, whether it's the growth factors, whether it's the stem cells that circulate, go and fix the area. So what the stem cell treatment is doing, or the platelet-rich plasma treatment, or any of the newer treatments, is trying to replicate your body's repair mechanism by us taking those workers and putting them where they need to do the work.